Welcome to Module 2 of the Introduction to Polio and the Global Polio Eradication Initiative course. In this section, we will look at poliovirus, its symptoms and transmission. Let's first look at what poliomyelitis is. Polio is a highly infectious disease caused by any of the three serotypes of poliovirus, types 1, 2 and 3. We will discuss more about the three serotypes later in the course. The poliovirus mainly affects children under 5. The virus replicates in the gastrointestinal tract and in rare cases in the motor neurons of the spinal cord. This replication of the virus results in cell destruction and paralysis. However, up to 95% of infected individuals will be asymptomatic. This means, although being infected with the virus, they will not demonstrate any signs or symptoms. The poliovirus is mainly transmitted by person-to-person spread through the fecal-oral route. In general, wild polioviruses have a distinct seasonal pattern of circulation that varies by geographic area. In tropical and semi-tropical areas, circulation tends to be year-round or associated with the rainy season. In temperate areas, polioviruses are most prevalent in the summer and autumn, although outbreaks can continue into the winter. Suboptimal hygiene, sanitation, and water quality all contribute to transmission, in addition to densely populated communities and weak health systems that are not able to consistently deliver routine immunization. Once an individual is infected, the virus will replicate efficiently in the intestinal tract. Infected persons will typically shed the virus in their stools for 3 to 6 weeks, whether or not they display symptoms. Shedding of the virus may be intermittent and is affected by the immune status of the individual. A previous natural infection or vaccination with the polio vaccine will reduce the extent and duration of shedding, while some immunocompromised individuals can shed the virus for years. The rate of secondary infections in susceptible households or close contacts is greater than 90%. This often means that if a child is infected with polio, other children in the same household will also be infected. The response to poliovirus infection is highly variable. Let's now look at the clinical presentation of the poliovirus. Poliovirus exposure results in one of 4 outcomes. 1. Inapparent or infection without symptoms is the most common presentation of the poliovirus. It is found in 72% of all cases. 2. Minor or transient illness is characterized by several days of fever or flu-like symptoms. This is found in 24% of all cases. Symptoms can include malaise, drowsiness, headache, nausea, vomiting, and sore throat. 3. Non-paralytic polio begins as a minor illness and after 1 to 2 days progresses to include severe headaches, stiffness and pain in the neck, back, or limbs. These symptoms usually last between 2 and 10 days. Recovery is usually rapid and complete. Non-paralytic polio occurs in less than 4% of all cases. 4. Paralytic polio. Paralysis happens in less than 1% of all cases. Paralytic polio is characterized by minor illness, which lasts for several days. This is followed by a symptom-free period of 1 to 3 days, followed by rapid onset of flaccid paralysis or weak, floppy limbs, with fever and progression to the maximum extent of paralysis. The paralytic phase then starts. It progresses rapidly to reach its full extent, usually within 48 hours of commencement. Some facts about paralytic polio. It is usually asymmetric. This means that it may affect one side of the body more than the other. Paralysis is associated with diminished or complete loss of reflexes, but sensation will remain intact. And the extent of the paralysis depends on the area of the spinal cord damaged by the polioviruses and the number of nerve cells affected. Due to the low rate of polio infection resulting in paralysis, the detection of a single case of paralytic polio is often an indication that the poliovirus is widespread in the community. Unfortunately, there is no cure for polio. However, treatment and support, such as certain physiotherapy exercises given at the onset of paralysis, can alleviate symptoms and the long-term effects of paralysis. In the longer term, corrective surgery, exercises, and the provision of prosthetics can help improve the quality of life of survivors. Just a generation ago, polio caused mass outbreaks in industrialized countries like the United States of America. Polio would strike in the warm summer months, sweeping through towns and paralyzing thousands of young, healthy infants and children. Children who were paralyzed in the chest could no longer breathe on their own. These children were sealed inside large medical devices which mechanically breathed for them. These still chambers were called iron lungs. Hospital wards, like the one pictured here, were filled with rows of patients inside iron lungs. The polio vaccine, given multiple times, can protect a child for life. Prevention really is the key. You have now completed this module on the poliovirus. In the next module, we will explore the differences between the two polio vaccines and learn how herd immunity contributes to prevention. First, try the end of the module quiz to recap what you have learned.